Hello everybody, this is Bread and Butter Primary Care. I'm Dr. Stokes, and today we're going to be talking some more about type 2 diabetes. The title of this video is Type 2 Diabetes, Organ Damage, What is it doing to me? So we're going to talk specifically about the problems that are caused to the body when someone has uncontrolled type 2 diabetes. So what does it do a little bit more in detail than in the previous videos. So quick review of the previous videos on diabetes and what it is. Type 2 diabetes is a problem in which insulin does not function as well as it should. Insulin is supposed to move sugar from the blood vessels into the tissues. If you have type 2 diabetes, your insulin doesn't work very well, your tissues respond to it, so more sugar remains in the vessels, less sugar gets into the tissues. So we're going to talk more about why that's a problem and what it ends up doing to your body. Diabetes overall is a vascular problem. So the issue with diabetes is that the presence of that extra sugar in the bloodstream damages the vessels. It damages the arteries that carry the blood. And that causes two general categories of problems. One is something called end organ damage, and two is direct vascular damage and increased risk of heart attack and stroke. So let's talk about that second one first. So one of the problems with diabetes is that having diabetes increases your risk of having heart attacks, strokes, and other vascular problems in the future. And it does that because it damages your arteries and makes them less pliable. So you can imagine your artery, I have a picture here of some Play-Doh, is like a piece of Play-Doh, or maybe another example I've used is a water balloon. As the blood flows through it, it's very nice and stretchy. And so it can, the blood can flow in, it can stretch out as the blood flows in, as the heart pumps and go back down. And that's why you can feel a pulse, because the blood pumps through and goes out, pumps through and goes out. And arteries are nice and stretchy like water balloons. If there's a bunch of extra sugar in there, what ends up happening is you damage the artery wall. You get little micro cuts inside the artery wall, which then have to heal with scar tissue. But the problem is that scar tissue is more stiff than normal tissue. So if you have this problem where you're getting damage and healing, damage and healing, damage and healing over years and years of time, what eventually happens is you go from a nice stretchy water balloon or Play-Doh artery to a very stiff, rigid lead pipe artery that's narrow and tight and can't accommodate any sort of obstruction. And so you get these narrow, tight lead pipe arteries. If you get a blood clot, you get a cholesterol plaque, you end up having strokes and heart attacks and blood clots and losing circulation to limbs and all that kind of stuff. And so that's one of the problems with diabetes, is that sugar is causing inflammation, it's damaging the artery walls, and it's increasing your risk of having heart attacks and strokes. So if you're 30 years old, 40 years old, and you have diabetes, the chance of you having a heart attack when you're 60 or 70 is much higher because of that diabetes than it would have been had you not had it. So that's problem number one. Problem number two is end organ damage. So you imagine the arteries of the body like branches of a tree. The very first branches that come off are big and round, and then every branch is a little bit smaller and a little bit smaller and a little bit smaller. So you have a huge artery coming right off the heart, the aorta. So it comes off and it comes down the abdomen, and then it branches into two that go down each leg, and then each one of those branches into two, which go down each side of the leg, and each one of those branches into several, which goes, by the time you get down to your toes, you've got these little itty-bitty tiny arteries that are carrying the blood to the tips of your toes. And so as that extra sugar is sitting in the blood vessel, the arteries that are most susceptible to the damage are the ones that are the smallest. So your big, huge aorta, it can take a lot of damage before there's going to be a big enough problem. But that little tiny end artery that feeds the tip of your little toe, that one doesn't take much damage. And so the first places you notice damage when you have diabetes are the places in the body that have the smallest blood vessels. Three main places to think about: extremities, mostly the toes and feet, the kidneys, and the eyes. So people with diabetes end up having neuropathy, which is the loss of sensation in their feet and toes, nephropathy, which is damage to the kidneys, and retinopathy, damage to the retina, which is the tissue in the eye that causes our vision. And the reason you get those problems is because those are the places in the body that have the little itty bitty tiny vessels that are very, very sensitive to damage. So as that sugar is floating in the blood, it's causing those little cuts, it's causing those arteries to clot off, and so the blood can't get through. The extremities, your toes, your kidneys, your eyes, they start losing blood supply. They start having less than they're supposed to, and so they start suffering damage. And so you start to lose sensation in your feet. You start to leak protein into your urine because your kidneys aren't filtering like they should. You start to lose some of your vision because of diabetic retinopathy. So first problem, you're stiffening your arteries, you're increasing your risk of heart attacks and strokes. Second problem is the end organs aren't getting the blood they need. And so you're going to end up with numb feet, which means you can get ulcers, you can get sores, you won't feel it, you don't know what's happening, those can get infected, and then that can cause major problems. You start having problems in your kidneys, you start having problems in your eyes, and then if it goes on, then that damage can even extend to larger organs and larger problems such as the gut or the liver and those types of things. So having that extra sugar floating in the blood makes your arteries more stiff, increasing your risk of heart attacks and strokes. It damages your end organs. And so that's what happens when you have type 2 diabetes and you have all that sugar present in the vessels. So I hope that helps you understand a little bit more about the things that happen when you have type 2 diabetes and why it's so important to control those sugars, to keep them under a certain level over a long period of time so that you can prevent that accumulative damage that happens over years and years of having those high sugar levels. This is Dr. Stokes with Bread and Butter Primary Care, and I look forward to talking to you again soon.